All right, welcome back, everybody. In the late 70s and early 80s, there was a whole lot of resistance to going to see an acupuncturist. They were like, what is that? But time has changed, and the gentleman you're about to meet has been doing acupuncture for a long time. He's got 4,000 hours of training and 40,000 practice hours. He's a doctor of Oriental medicine, and he's trying to help me with this itch. Take a look. Why on earth would anyone let anyone else perform acupuncture on them, prick their bodies with tiny little needles? The answer, according to Dr. Stephen Paine:
most folks who come, at least in the U.S., most folks who come to acupuncturists and doctors of Oriental medicine, which is what I am, come because they've tried everything else, they've exhausted every other approach, and they want to fix what ails them.
My ail is an itch. Over the past 6 months, I've developed a terrible itch that no one has been able to help me with. So far, I've been to a GP, an allergist, a dermatologist, and a naturopath. I'm still itching. So why not get stuck with needles?
When you analyze something from a little different perspective, sometimes it sorts itself out very nicely.
So how does this work? Well, Kara's always telling me there's an old saying, where there is pain, there is no flow. Where there is flow, there is no pain. Thanks, Kara. So the pins are actually helping to start the flow.
We applied needles all over the body. They're probably an average of between, say, 10 and 15 needles per person, per session, in safe locations. And generally, the needle points are at the intersection of where the nerves meet, although they don't go into nerves, where the lymphatics meet, where the circulatory system meets, the veins and arteries meet, but not into the veins and arteries. So we use points which have a very strong influence on the body. When a body gets stuck with a pin, there's a whole amplification process that takes place.
Here's an example.
A pin right here in the hand for a severe abscess of a tooth in the mouth. Just doing that one point can send a signal up via the peripheral nervous system to a location point where the tooth is located. We know that from having done it so many times. And that one pin can start an anti-inflammatory process in the body, whereby the body can relieve the pain, clear all the infection, the pus, and so on, and completely resolve a problem with one pin.
My tooth doesn't hurt, though. I itch. And all my blood work came back normal from all the other doctors. So what's the plan here?
And look at the whole history of the person. Again, the emotions, physicality, work habits, eating habits, and all that stuff. And then we work with points that are going to address those issues. Now, the fundamental difference between Western medicine and Chinese medicine is Western medicine is excellent at disease. It studies disease and knows it extremely well. We study health, and we know that very well. When you go to an MD, for example, and it's not his or her fault, they've got 7 minutes generally that's allotted to them by the HMOs and by their bosses. There's not a whole lot you can say in 7 minutes. We have people for an hour the first visit, and then thereafter we see them for roughly an hour of treatment. The person knows better than anybody else what's happening with their body. So we get them to talk, we get them to fill out forms. We then have a baseline to operate from. And, you know, geez, no one, what I get repeatedly with the forms that I have created here is no one ever asked me that. Which is very interesting. So you might check it out. Maybe Dr. Paine will ask the right questions and you'll be able to give them the right answers. Acupuncture has been around for thousands of years, and even hospitals, mainstream hospitals, are starting to incorporate it into their practices. So you never know. Dr. Paine will be the first to also tell you that there are people out there with minimal training that are permitted to do acupuncture. So if you're thinking about doing this, make sure you check out their credentials and make sure you ask to speak to other clients that they work on. All right, Alessa.
I am speechless. That was a whole lot of naked Scott.
A lot of naked me.
Melissa Gonzalez is here. She's going to tell us all about pop-up shops and tell us how they're helping local designers get noticed. It's coming up next on Better Connecticut.